Well, the world's largest vaccine producer is seeking emergency approval for a COVID-19 inoculation in India. The Serum Institute of India wants the nod for the vaccine it's developed with Oxford University and AstraZeneca. It comes on the heels of Pfizer applying for similar authorizations over the weekend. Now, Rebecca Bundan joins us from Mumbai. Rebecca, what are the advantages that the Serum Institute is claiming AstraZeneca's vaccine has over others, perhaps?
Yeah, there are a few vaccine candidates, but AstraZeneca seems to be emerging as a front runner, largely because of this partnership with the Serum Institute of India, which is allowing local production, of course. And the Serum Institute says it's already produced some 40 million doses of the vaccine. That's what it said in November. So this local production is, of course, going to make it much easier for distribution across the country, in a country with more than 1.3 billion people. The other significant advantage for the AstraZeneca vaccine in India is the fact that it has to be stored at 2 to 8 degrees Celsius. Now, that's significantly warmer than the temperatures of the Pfizer vaccine, which needs to be stored at minus 70 degrees Celsius. That's going to be a massive challenge for India with the Pfizer vaccine. Even the cold storage temperatures for something like the AstraZeneca one is going to be difficult to put those facilities in place. But storage at minus 70 is really going to be a big challenge. So that's something, again, that's working in the favour of the AstraZeneca vaccination, those storage temperatures that it requires, which are higher than Pfizer's.
Encouraging signs, Rebecca, but how soon could India begin rolling out vaccines?
Well, India's Prime Minister Narendra Modi on Friday talked about the possibility that a vaccine could be ready within the next few weeks, but then the actual rollout and the vaccination drive will depend on the approval of scientists, which is what India is now waiting for, that nod to actually go ahead with this. And but once that does go through, the vaccination drive can begin. And the Health Ministry has said that there's the possibility of 250 million to 300 million people being vaccinated in India by July or August next year. But then once the vaccine is rolled out, it's not immediately going to be widely available to everyone, it's expected. First, it will be people like frontline health workers. They're going to be the ones that will receive it on a priority basis. Also, the police, before it's rolled out more widely, the elderly. So those people will be treated on priority. But after that, the challenges will begin in terms of distribution, the cold storage that's needed, the logistics of distributing the vaccine across the country, reaching towns and villages, and also the pricing strategy. So there's still a lot of work that needs to be done.
Yeah, it certainly is. Thanks very much for that update. Rebecca Bundan speaking to us from Mumbai.